Welcome to Mary McCorvey Experience Over Expectations podcast, which you can find on YouTube, Substack, and any place you find your podcasts. Be sure to subscribe today.
Welcome to Experience Over Expectation, where we encourage you to let go of the grand plan and live on your terms. I'm Mary McCorvey. Today I'm joined by Dana Sherwin, a seasoned health system executive turned patient advocate and communicator. For over 35 years, she has been helping hospitals, managed care organizations, and consulting firms untangle the complex web of patient-physician communications. Then Dana found herself on the other side of the table, facing a life-threatening illness and undergoing a stem cell transplant, becoming a patient rather than a manager. That shift from leader to lived experience gives her a very rare vantage point. Systems meet stories, policy meets pain, expertise meets empathy. Thank you so much for joining us today, Dana. Really appreciate you being here.
Thank you so much, Mary. It's my pleasure.
Well, tell us a little bit about, first of all, before we get into your story, tell us a little bit about your background in helping the healthcare providers communicate better with their patients. How did you get into that in the first place?
Okay, well, it really all starts with my interest in the healthcare administration field. From the time I was a teenager, I guess one could say I was very fortunate. I had a father who just loved his career, and he was an executive in a very large health insurance company. And he just went to work every day, so enthusiastic and with meaning and purpose. And he was such a great role model for me. He brought me home brochures of different professions in the healthcare field. One was to be a nutritionist. One was to be a human resources professional. And the third one was to be a hospital administrator. And I said, oh, hospital administration, that sounds really interesting. Because I was a member of many clubs. I led certain clubs. I just sort of had it in me to lead people and make things better, make things more efficient. And I, in my sort of childhood and development years with a lot of sick relatives around me, I just found that the healthcare system was really important to help people. And I just was, and because of my father, I was very drawn to the field. So I ended up going right from college to graduate school in healthcare administration. And it was a wonderful program, very inspiring professors who I'm still in touch with to this day, and a lot of fellow classmates who I'm still in touch with. And sort of there's this connection and love for the industry and doing good in the world, and doing what you can, whatever level is that you can, no matter which area of healthcare you're in. I have found that most people are very dedicated to I'm in the right place. I am helping people, and I have meaning every day I wake up, and I have meaning in my life. I worked at
I didn't mean to interrupt you.
Mhm.
I'm so glad to hear you say that, and I think it's an important point. So we give a lot of kudos, and rightfully so, to first responders, those people that are on the front lines of trauma and tragedy and helping people get from where they are to where they need to be in order to have their health care taken care of. When it gets to the hospital, when it gets to the insurance companies, it gets a little bit more murkier in that area. And generally speaking, I'm not completely sure that people believe that, the healthcare system has their own interest at heart.
There's a lot to unpack there, but if we really get down to it, that no matter what job someone may have at a hospital, when they're there to help people and support people, whether it be from maintenance to housekeeping to the dietary to serving food to a nurse's aide to the nurses, and really all the even information technology people today helping people at the bedside access access the internet. I mean, there is this sense of connection, and I think that's still there. I think the larger issues are the pressures on the healthcare system. And let's just start, at the emergency room. And I don't know one emergency room that has an easy flow and that you can get in and out of an emergency room before like a 6 to 8 hour period. There's a lot of pressure on the systems today, and there are a lot of root causes for that. One being people who don't have insurance and they wait for the last minute to go seek care. People who have insurance who they wait till the last minute to find a primary care doctor to set up preventive health and monitoring. There are so many reasons people are afraid of the healthcare system because one of their family members had a bad experience or they had a bad experience. So there are so many reasons underlying why the healthcare system is under so much pressure, stress, and resource difficulties in resource allocations and where really the money goes. So I think that's, I think about that a lot. I think about these issues a lot. Now I think about them in the context of patients taking agency and being able to do whatever they can to access care at the right times in their life, which really start very early on. And really going back to the progression of how I was a former healthcare executive who now works exclusively on helping doctors and patients communicate better and giving patients more agency and being engaged in their care. Why I made that transition is that I had a health crisis in 2019 and I needed a stem cell transplant. There was no other cure. And I knew that I was living with this it was a chronic blood cancer disorder. And I was living with the disease for about 20 years, able to go to work and raise my family and do all the things that I needed to do, but with this really hanging over my head because my disease just required monitoring, but I always knew there was no cure. And I always knew that if my disease progressed to a point where I needed that stem cell transplant, I would have to have it. So it's a pretty intense process to prepare for the transplant and then 5 weeks in a hospital and then the whole recovery period. But after about 3 years, I started thinking about, well, I can't go back to the previous career I had. What can I do? And I got inspired by one of my doctors.
May I ask why you couldn't go back to the previous career?
Because the recovery from my transplant was rocky, and I didn't have the energy to have really 24/7 responsibility, or at least be working a 60, 70-hour week, which is required when you're heading an organization. And I knew, and I loved it. I loved my work. My last job was one of my favorite jobs because I helped create this managed care company. And then I worked my way up the ladder. And then I became the executive director of a health plan that served Medicaid and Medicare beneficiaries. And it was just a wonderful highlight of my career. And I got so much out of it. And so when I really got sick and had to wait it was about 10 months before the transplant because there's a lot of preparation. I didn't really have a chance to think about my career. I didn't have a chance to think, oh, I'm going through post-traumatic stress disorder because I'm losing my career of 35 years, because all I cared about was being alive and living quality life. However that was going to look, what the quality of life was. So I'm now almost 6.5 years post my stem cell transplant. And a couple of years ago, I just got inspired by one of my doctors who said to me, she introduced me to somebody and she said, "Oh, Dana, you're such a good patient." And I said, "Well, oh, means my health, I'm doing well?" She goes, "No, I didn't mean that. What I meant was that you come to every appointment really prepared with what you want to accomplish, with your questions, any research that you've done, and any follow-ups that are needed. And we know we could always rely on you to tell us what we're missing to do." And I said, "Doesn't everybody do that?" And she said, no, people don't. Mm-hmm. And so I thought, maybe there's something that I know and that I've learned through whether it was being an executive or just being a patient who went through this and applying all the skills that I had. So I started doing research on the topic. I thought, like, maybe I know something, maybe I can be helpful here. Maybe this could be a direction for me to continue to make a contribution to the healthcare field. And I spent time researching the topic and calling people and talking to people and finding out what was done over the years to really understand how to upgrade patient-physician communication.
So let me make sure I understand what you just said. So you did a lot of research and understanding the physician patient communication. Was that on the system side because that's where you had been?
It is really as it relates to, in a way, like outpatient care, how
Okay.
patients
Right.
communicate on their regular visits or on their specialty visits. So, how does a patient have a voice in talking to doctors? And not from the perspective of, oh, he's being ready to fight. And sometimes that word advocacy has a negative connotation. It's about like having this knowledge, the knowledge and skills and the strategies and the tips and the tricks and all that stuff. What gives people agency? What gives people confidence to go into a doctor's office no matter, what they're feeling? Because typically no one likes seeing doctors. So sometimes people avoid care. They end up being in a crisis or urgent situation. But the point being is that people learn how to play chess, or they learn a hobby, or they spend all this time trying to figure out what car they want to buy. But how much time do people really spend on making sure all the fundamentals are in place to understand how they take care of their health, their access to the healthcare system, access to hospitals, emergency rooms, urgent care centers, access to specialists, how you find specialists, what it means to evaluate doctors. So there's so much knowledge out there. And when you're in crisis, you don't go on. Your first inkling isn't to
That's
spend two
exactly right.
hours doing research. Your
Yeah.
first inkling isn't to go to Barnes and Noble or Amazon and buy a book. Your first inkling is to say, okay, let me just find a doctor and let me take that first step. But what if before you got sick, you had the knowledge of how to navigate the healthcare system, how to navigate conversations with doctors? And that's sort of the conclusion that I came to. And I felt like, well, nobody's really talking about this aspect that's so important.
And how did you communicate or access patients for that side of the research that you did?
Fortunately, I would say for the past 50 years, health researchers at academic institutions have been doing research for at least the past 50 years on what makes people able to engage in their care better. And then they also measure the outcomes. And so all this research was research about how patients behave and how physicians respond to the patients when patients, what regardless of the state that a patient is in. As one example, which I thought was really interesting and something, I never focused on as a healthcare executive, but it's if you give patients questions to ask the doctor before the appointment, and they're called question prompts. It's the technical term. I didn't know this either. You give the patient prompts to ask questions before their appointment. The patients are more engaged, become more informed. It triggers other questions the patients may ask the doctor, and it also engages the doctor in a way that the doctor psychologically knows the patient is there to work in partnership with me to figure out what the diagnosis is, what treatments are necessary, and also complying with whatever treatment protocols that we set up. And so that's one example of really being out there.
Yeah, so I have a question about that. So in the body of research that you had access to, and I would imagine a lot of people have access to that research that's in the public domain. How did doctors respond? I remember you and I both remember when the internet really came into being and blew up. And one of the things that I recall happening is that doctors were very dismayed that people would come in with a Google diagnosis. How do you manage that dynamic between patient who wants to be engaged and the doctor who has spent years and years and years of education and experience and understanding what and discerning what the patient has. How do you handle that dynamic first from the physician standpoint? That would be of interest to know. And secondly, from the patients.
All right. So things are changing. So everybody talks about, and the medical community talks about Dr. Google. They generally don't like when the patients come
Sure.
in, I've Googled this and here's my file, and hands over the file to the doctor. And it's not really how a medical interview is conducted. It also, because the doctor has knowledge and has to proceed with all their questioning and investigation with the patient. So generally, that's not something that the doctor will advocate for. However, there is a way. I just don't think that doctors are used to talking about this to patients. If you want, if you want to talk about the research that you've done, whether it's Google or now AI, which sometimes gives more specific and more structured information to patients, and the doctor may say, I know you're interested and I know you're probably going to want to Google it. This is how I would go about learning more about this diagnosis. And then the doctor could say to the patient, okay, these are trusted websites. This is how I would go about it. But doctors really don't have the time. Appointments are like 15, 20 minutes maximum.
Yeah.
So it's a very time constrained situation. Why I say this is changing is that it's becoming more and more accepted. Well, let's just say we're at the initial processes of physician practices and hospitals trying to use AI more in the delivery of care and the communication of information. With that, I think that the providers are moving very gradually to trying to figure out how to guide patients if they want to do their own research. So I think that's where ultimately this will be. In the meantime, it should not prevent anybody, any patient, from doing their own research. It's just how then you present the research to the doctor. Meaning, if you suspect you have something, then maybe you want to Google, I have these symptoms and these are potential diagnoses. And then you ask AI, okay, from these diagnoses, I'm about to see my gastroenterologist. What questions should I ask my gastroenterologist? So you come to the appointment prepared with questions to ask, which means shows the doctor you're interested, you've done a little background research, and then you want them to guide you. So, doctor, I found this, this, and this. Can you please explain to me? Can you please guide me? So I think it's like a balance now. A patient cannot, I don't think that it's prudent to go to a doctor's appointment without, if there's something you don't know before the appointment, you should Google it or AI it and come out with questions to ask your doctor and be prepared, or at least be prepared with what the language of what you're experiencing. And I talk about that a lot in my 5-part framework of communicating better with doctors, but language is a very big thing. So understanding, what the words are, how to express yourself, all of those things, what your diagnosis is, how to pronounce it, what it means, your medications, how to pronounce them, what it means, how you take them. So being educated in the language of diagnosis and not just saying, okay, the doctor will take care of everything and I'm too afraid to really understand. I'm too afraid to step forward. I'm scared. I don't feel confident. I feel overwhelmed, which these are normal feelings that everybody has. Even I was in the healthcare field all those years, and I didn't have a primary care doctor because I was having children. I saw OBGYN. That was my primary care doctor. Those doctors are not really trained to be your primary care doctor. That was one of the mistakes that I made, and I was in the healthcare field. So if you have an established relationship with a primary care doctor, or if you're over 60, 65, to have a geriatrician, which I have one now, and it's just made a world of difference because geriatricians understand how the aging process then interacts with particular diagnoses or particular medications, or what in particular to look look after. If you're you're one of a handful of older patients that a primary care doctor has, but the rest of their practice are people in their 20s, 30s, and 40s, you are missing out on a lot, because doctors who focus on older people have more knowledge in how to treat older people. So that's just a little plug for geriatricians or geriatric medicine physicians. And there is a very short supply in this country of geriatric medical physicians.
So, what I'm hearing you say is that doctors are more willing these days to accept questions and comments and things like that from patients than they were 25 years ago. And that patients also, as you say, have to be the CEO of their own healthcare and make sure that they do the research necessary to go when they go into a doctor's appointment so that they have their questions ready, right?
Yes, yes. I think, it's sort of getting over that hump. So again, one of the parts of my framework is developing the courage, because there's so much, fear and stress related to either being sick or thinking you're sick in some way. And all that stress, and how do you couple that with needing to do things to improve the quality of your health? How do you do things? Well, usually when you give people a checklist, a set of tools, it gives people a pathway, and it probably
Mhm.
lessens the stress and anxiety. And I know for me it did, because once I was in my recovery from my stem cell transplant, I had to get very habitual, regimented about what I needed to do every single day and what I needed to track in order to have that next conversation with my doctor at the next appointment. And I'd keep notes on that. This is what I was feeling. This is a question. And I didn't have every little question answered in between appointments, but I started building, okay, what do I want to learn more about, or what's happening in my recovery? And I had to get more habituated with the structure that I was using to take care of my own health, my own care management.
Well, tell us about the moment when you switched from healthcare administrator to patient. And that was a very difficult transition. It's one that I'm familiar with because I've had a terminal diagnosis myself. So I have some sense of what that's like. Tell us about what that was like for you.
Let's just say when my health crashed, I was in a lot of pain. And at the first, so again, I couldn't really think about, okay, I knew there were people back at my company that could really take over and take my place. I think we set up a very good organization, and I really wasn't worried about like things getting done. And I couldn't really think about a time frame for me going back because I was in so much pain. And I participated in a few clinical trials, and then I had to have a bridge chemotherapy just to keep me alive as we planned out having a stem cell transplant. And I really just I just felt like I needed to do whatever they told me to do. And I kept a lot of notes about what I needed to do. And I found that keeping these notes and note taking and lists about how I needed to run my everyday life, being in such pain, it just helped me get through all the fundamental things that I needed to do to get to the point that I was ready to be admitted to the hospital for the stem cell transplant. I don't feel like it's an easy process. It wasn't an easy process. Making the lists didn't make it easier, I think, at the beginning psychologically, but ultimately it really helped prepare me for having a smooth 5-week stem cell transplant and then a smooth recovery afterwards. So I was of the mindset. So I was very scared that I wasn't going to make it out of the hospital because the statistics were not great. They've gotten better over the past 10 years, but people who have stem cell transplants, it's gotten so much better. Modern medicine is just an incredible miracle. So it took me a number of months, once I knew I was on chemotherapy before the transplant, and I knew that I had to go and do the transplant. And at first, I felt I better figure out how to get everything done at home and prepare really prepare to die. And it got to a point after like 2, 3 months, I said, why am I preparing not to come out of the hospital? I just had to shift my thinking. And something clicked in my head and said, well, if I don't get it all done, because I knew there's just a never-ending amount of things that you need to do to prepare for life and death. And I just said to myself, okay, if I don't get it done now, I'll finish it when I come back out of the hospital. That totally like shifted my perspective. It was like the weight was taken off my shoulders. And I had to do this myself. I really had no like coaching or social work or anything related to that. And I have an extremely supportive family. I had a lot of people there for me to help me. But there's certain things you have to figure out yourself. And I guess through my process, I had to figure out, and I got sort of tips from doctors, like to get through the 5 weeks, wake up every day and have a schedule for yourself. And you could barely like walk around, and you barely, even want to keep your eyes open, but like have a schedule. From this to this, you take a shower, you're going to have a meal, you're going to take a walk, you're going to read a book, you're going to have company, and have a schedule for yourself every single day. And then another doctor said to me, CEOs don't do very well during this period of time because they're always trying to be in control of everything. But given the nature of this treatment, you have to let go, and you have to let us do our work. Mm-hmm. Which didn't mean that I wouldn't ask questions, question things, or want to understand what was happening to me. And I think that was good, but it's the change in perspective. Mm-hmm. And I did let go. I let go before I went into the hospital. I let go while I was in the hospital. And I think that really helped me. But it's when I got out of the hospital, and then I had to really take care of myself every day. There was no really nursing assistance. And then after 7 months, it was COVID. And I got locked out of everyone who had like a non-urgent condition got locked out of the system. So I spent like 3, 4 months without being able to see any doctor in person, which I think was harder psychologically. But I did everything I could to adhere to like best practices for recovery and doing things for yourself and having your own daily appreciation of, I'm here today, I'm here, I can take a shower by myself. I'm here, I could decide what I want to eat. I could try interesting foods, but I had to watch it with the recovery. You're not allowed to eat. There's a whole list of foods you're not allowed to eat because your immune system is compromised. So you have to be really careful about what you eat. But you go through a process where every day you wake up and, I have people I love, things I like to do, things I'm looking forward to, and not thinking too much of the future. So sort of having a process and having structure. And I think that's what really was in my mind when I decided that this was, I think, an important area that people don't talk about. And that's how you really take agency for your own health. Some people can't, for whatever reason, disability, age, your mobility is impacted, you have certain limitations, you need support, you need help. But if you are really able to take care of things yourself, there are ways to do it that isn't just, oh, mind over matter, mind over matter. There are strategies and actions that you can take to make your health better, to make you feel better, give you more courage and confidence to take care of your health. And then whether it's taking care of the health of your children or the health of parents, helping you help them. I think these are, important things that nobody teaches you in school, in college. Health insurers don't teach it to you. Employers don't teach it to you. And doctors do not have time to teach it to you during the 15-minute
you
appointment.
Have a 5-part framework. How do people access your 5-part framework?
Well, I can give you a short summary, and then people can find me on my website. It's called thethinkingpatient.com. And so I have information there. And I also post on LinkedIn on a regular basis. But in a nutshell, The first part is preparation. We talked a little bit about all these areas already, so they'll sound familiar to you and your audience. So preparation, before you go to a doctor, prepare it in advance, preferably in writing, what your priorities are for the appointment, what your goals are, your short history, and questions you want to ask the doctor, research that you might have done, and any follow-up actions. You prepare that in advance. It makes the appointment so much more efficient and productive, and physicians seem to respond very enthusiastically to organized patients going in, thoughtful, not just organized with like comprehensive tons of information. No, thoughtful, concise information to help the discussion flow with the doctor. The second we talked about is language, having the language of your diagnosis, of your medications, language of your pain. When I was in pain, I didn't know like what the words were to describe pain. People you might have seen the smiley faces on the wall from 1 to 10, sad face to smiley face, and doctors say, how much pain are you in, pointing to a face? Well, I never really related to that kind of evaluative process. And somebody did research and came up with, I think there are 72 words that describe pain. Most people don't know about this. It was a research study that was done. And so knowing the language of your pain, to journal, to research, pronounce your diagnosis, pronounce your name of your medications. The third is questions and putting together questions. So many trusted sources on the internet these days about questions you can ask a doctor, no matter what type of doctor it is. Come prepared with questions. So when you interact with the doctor, you have these, I forgot the question, write them down. So you have the questions, and then you're more engaged with the doctor. If something the doctor says triggers another question for you, or doctor, can you explain what you mean? Or can you point me to other resources? So the third is questions. The fourth is participation. When you're actually in the exam room, talking to the doctor, doing all the things that I just discussed, you will be present. You will be focused. You will be engaged when you're there to have that conversation. And by having that conversation, the doctor will be able to know what you know and what you don't know. And you'll be able to know what you know from what you don't know by having that very present interaction. And then the fifth is courage. And not easy for anything, building courage, if you're not naturally inclined to have courage. And you may be more inclined on some things than the other. You might have confidence, but you usually develop the courage and confidence when something you have experienced over and over and over again. But most people, their first encounter with the healthcare system on an acute illness or a chronic illness, it's so overwhelming. And you really need to develop. The earlier you can develop that courage and confidence to engage with your doctor, the more you will be able to, I think, try to foster the best health outcomes possible. So those are the 5 parts.
Well, thank you, Dana. And thank you so much for being with us today. We really appreciate it. One of the things that you pointed out, which I think is a great way to wrap up here, is that when faced with your diagnosis and the acute state that you were in, you said, well, I need to prepare to die. And I've been there and I've done that. And it's a pretty sobering experience. But along the way, you decided, oh, wait a minute. What about if I prepare to live? That's what, if I were to synthesize this entire conversation, it would be about that. And people to take away a message from you. It's prepare to live. And what a great and inspiring talk this has been. I really appreciate it. Dana Sherwin, thank you so much for being with us. This is Experience Over Expectation. I'm Mary McCorvey.
You've been listening to Mary McCorvey's Experience Over Expectations podcast. Be sure to subscribe today on YouTube and Substack, or listen wherever you find your podcasts. Thanks for tuning in.